Does iodine help with thyroid nodules and goiter? That is a question I commonly receive that I'm going to answer today, and also talk about a patient who had thyroid nodules that completely resolved over 18 months. So my name is Dr. Tom Refrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and I've had the opportunity to see over 100,000 patient visits over the last 35 years, many of whom have gut and thyroid issues, and many of those are nodules and Hashimoto's. So this woman came in a while back, 69 years old, with thyroid nodules, Hashimoto's, for over 10 years, was on medication, just feeling miserable, the usual thyroid symptoms: fatigue, weight gain, aches and pains, brain fog, digestive issues. The first thing we did is an initial evaluation. I typically am looking for underlying root causes in these 5 main areas: deficiencies, toxins, infections, hormones, and food reactions. So one of the things we found with her was iodine. Her iodine was low. So in going over the treatment, our treatment protocol involves, diet and supplementation. So as far as whether you treat with iodine or not, that's a complex issue, because there are many doctors that say, for thyroid issues, absolutely no iodine. As a matter of fact, you need to restrict it. And there are others that say, oh yeah, you need iodine. It's the most important thing for your thyroid. So which one is it? Well, there's no one size fits all. So the thing is, if you have thyroid issues, whether it's goiter, nodules, Hashimoto's, hypothyroid, you just don't want to run out and take iodine. You want to be under the guidance of a healthcare provider. So you want to check your iodine status. So if you are low, then absolutely it can be very helpful. And you also want to monitor along the way, like we did with her. Every so many months we checked her TSH, free T4, free T3, TPO antibodies, and thyroid globulin antibodies, amongst other things, but these are the minimum you would check every few months while you're on this, because she did very well. All these numbers, her high TSH got better, her low T4, low T3 got better, her elevated thyroid antibodies went down to normal. This is while taking iodine, a relatively high dose, 12.5 milligrams is in our iodine formula, and all these numbers improved with her, even though many people, many doctors, many authorities would say absolutely do not give it under these circumstances or any thyroid circumstances like this. So most of the cases I see with nodules and goiter, and we use iodine in most cases and they improve, that's the scenario I typically see. There is a smaller percentage of patients that iodine doesn't do well with, in which case when you're monitoring, then you say, all right, we're going to stop that and go another approach. So again, it can be so helpful, like it was with her. The end result with her at the 18-month period of time, she had 2 thyroid nodules, one resolved at 6 months, and then the other one at 18 months total. So both of them are completely gone in 18 months. The second one was a little under a centimeter that completely resolved. And the first one was much larger. It was partially marginated, a large nodule that dissolved even more quickly. That was dissolved at 6 months. What we did, besides the iodine, that's not the only thing. So it's very important to take selenium, all right? You want to take selenium when you take iodine so the thyroid can use it properly. If someone is low in iron, she was not, but if someone is low in iron, then they're not able to utilize iodine properly in the thyroid. So you want to assess that. Other things I use with her, like vitamin C, she was low in B12 folic acid, so we gave that. Many are low in zinc, so we use that as well. N-acetylcysteine can be very helpful, and inositol is another nutrient that can be very helpful. We start out with the functional 5 though, which is multi-fish oil, vitamin D with K2, magnesium, and probiotic. Those are the 5 most important nutrients. I call them the functional 5 because they're their basic foundation, what most people would really benefit from taking. And beyond that, the very important is diet. So most everyone I see with thyroid nodules, with thyroid issues, gut issues, is gluten sensitive and has other food sensitivities, as did she. We had her on the free diet, which is not only free of gluten, but gluten grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, and processed foods. So it's free of all those foods most commonly responsible for inflammation and chronic autoimmune and other health issues. So we had her on that as well. And if you would like a copy of the Free Diet Phase 1 food chart, I'll leave a link below. You can click on that and we'll send that off to you. Also, if you would like further information on what we just talked about, I have a chapter about it in my book, The Free Diet, chapter on thyroid nodules, that talks about more in detail on this topic. So the thing is, if you have goiter, nodules, autoimmune thyroid issues, Hashimoto's, it's not a standalone thing, like there's something in your body that brought it on, because at one time you were normal and healthy, and then all of a sudden or gradually you're not. So something in that time brought it on. The important thing to realize is your body has a tremendous ability to heal itself. So once you find out the underlying root causes and provided the proper solutions, I believe most everyone can improve and get better. So feel free to subscribe to my YouTube channel below, and look forward to seeing you next time. And I'll leave that link for the Free Diet Phase 1 food chart below. Take care.